First question. Which antibiotics act by competing with the para-aminobenzoic acid of bacterial cell? Option A. Sulfonamide. Option B. Beta-lactam. Option C. Aminoglycosides. And option D. Polypeptides. Correct answer is option A. Sulfonamide. Second question. If we are neutralizing spectacle lens by trial lens, which surface power we get? Option A. Back vertex. Option B. Front vertex. Option C. Approximate power. And option D. Equivalent power. Correct answer is option B. Front vertex. Next question. Cells and flare in anterior chamber can be seen or graded by option A. Optical section. Option B. Direct illumination. Option C. Parallel piped illumination. And option D. Retroillumination. Correct option is option C. Parallel piped illumination. Next question. Anterior segment can be examined by option A. Keratometer. Option B. Tonometer. Option C. Ophthalmoscope. And option D. Slit lamp biomicroscope. Correct answer is option D. Slit lamp biomicroscope. Next question. Which method gives 3D stereoscopic view of retina? Option A. Direct ophthalmoscopy. Option B. Indirect ophthalmoscopy. Option C. Distance direct ophthalmoscopy. Option D. Monocular ophthalmoscopy. Correct answer is option B. Indirect ophthalmoscopy. Next question. In which method examiner come closer to the anterior focal point of the patient? Option A. Distance ophthalmoscope. Option B. Distance direct ophthalmoscope. Option C. Indirect ophthalmoscope. And option D. Slit lamp biomicroscope. Correct answer is option A. Distance ophthalmoscope. Next question. In direct ophthalmoscope, magnification achieved with plus 20 diopter is option A 4x, option B 3x, option C 2x, and option D 5x. Correct answer is option B 3x. Next question. In distance direct ophthalmoscopy, light thrown into patient eye from option A 10 cm, option B 5 cm, option C 20 to 25 cm, and option D 40 cm. Correct answer is option C 20 to 25 cm. Next question. Scheiner principle and optometer principle are principles of option A keratometer, option B retinoscope, option C autorefractometer, and option D ophthalmoscope. Correct answer is option C autorefractometer. Next question. Which method is used to remove foreign body embedded in bulbar conjunctiva? Option A. Swab sticks. Option B. Hypodermic needle. Option C. Epilation forceps. And option D. Above all. Correct answer is option B. Hypodermic needle. Next question. Stages of lamella separation and incipient cataract are a type of option A. Senile cataract. Option B. Congenital cataract. Option C. Traumatic cataract. And option D. Developmental cataract. Correct answer is option A. Senile cataract. Next question. Plasma treatment of silicone lenses is done using option A. Methane gas. Option B. Ethylene. Option C. Hydrogel. And option D. Elastomers. Correct answer is option A. Methane gas. Next question. Chronic simple glaucoma is also known as option A. Primary open angle glaucoma, option B. Angle glaucoma, option C. Congenital glaucoma, and option D. Absolute glaucoma. Correct option is option A. Primary open angle glaucoma. Next question. In cuneiform senile cortical cataract, opacity extends option A. from central to periphery, option B. periphery to center, and option C. anterior to posterior, option D. posterior to anterior. Correct answer is option B. periphery to center. Next question. Excessive use of local anesthetic cause all of these except option A. epithelial and stromal opacification, option B, eruption of cells, option C, stromal tear, and option D, complete corneal staining. Correct answer is option C, stromal tear. Next question. Which of the following is not a method by which a virus produces a disease? Option A, inhibits cell metabolism and synthesis. Option B, compromising host defenses. Option C, inducing tumor formation. And option D, toxin or enzyme production. Correct answer is option D, toxin or enzyme production. Next question. Killing of living microorganism including bacterial endospores and cysts is known as option A, disinfection, option B, antiseptics, option C, sterilization, and option D, colonization. Correct answer is option C, sterilization. Next question. Greenish tinge of glass is due to option A, silica, option B, iron oxide, option C, lead oxide, and option D, cupric oxide. Correct answer is option B, iron oxide. Next question. Instrument used to plot the transmission curve is option A, radiometer, option B, transmitter, option C, spectrometer, and option D, spectrophotometer. Correct answer is option D, spectrophotometer. Next question. Polariscope is used to detect option A, veins, option B, bubbles, option C, strain, and option D, feathers. Correct answer is option C, strain. Next question. Process of heating the lenses to softening point and then cooling rapidly is called option A, thermal, option B, toughening, option C, truing, and option D, laminating. Correct answer is option B, toughening. Next question. The central portion of the lenticular lenses in which the prescription exists is called option A, margin, option B, core, option C, aperture, and option D, principal. Correct option is option C, aperture. Next question. Thermoplastic polycarbonate lenses are made by a process called option A, injection molding, option B, casting, option C, cementing, and option D, thermosetting. Correct answer is option A, injection molding. Next question. Which facial type is considered ideal for most of the frame shape? Option A, round, option B, oval, option C, square, and option D, above all. Correct answer is option B, oval. Next question. Name the instrument which is used to check the stress in a lens fitted in metal frame. Option A, ophthalmoscope, option B, polariscope, option C, radioscopy, and option D, vertex meter. Correct answer is option B, polariscope. Next question. The following are the problems faced with high-powered lenses except option A, decreased field of view, option B, increased lens aberrations, option C, increased field of view, and option D, above all. Correct answer is option C, increased field of view. Next question. Long-term exposure to infraradiation results in option A, heat cataract, option B, blue dot cataract, option C, versatile cataract, and option D, stellate cataract. Correct answer is option A, heat cataract. Next question. The best way of heating the nylon frames are by using option A, glass beads, option B, hot water, option C, forced hot air, and option D, sand in a hot tray. Correct answer is option B, hot water. Next question. Impact resistance of a lens material can be determined by using a test called option A, drop ball test, option B, Bayes test, option C, Tabor test, and option D, Caliber's test. Correct option is option A, drop ball test. Next question. In most of the fixed focus magnifiers, the emergent rays reaching the eye are option A, parallel, option B, convergent, option C divergent, and option D perpendicular. Correct option is option C divergent. So please like, share and subscribe for more videos. Thank you.